Before starting this project, I knew practically nothing about El Salvador or its public health system. And when I decided to take on the challenge, I had no idea what I was going to find. I'm in El Salvador, at the San Juan de Dios Public Hospital located in Santana, and I have come because their management team contacted me to guide them in the creation of a humanization plan that will help transform the experience of patients, caregivers, and the entire healthcare staff. When the hospital director asked me to help her humanize her hospital, I didn't think twice. I am a person with a sincere vocation in improve the care of all the patients in her facility.
When I contacted Albert and told him of my desire, he was very interested in helping us. That was the beginning of this great project. So for me, their help was like seeing the light of day, because I knew I couldn't do it on my own.
A project like this has to be carried out by and for people. That is why one of the keys to making these projects work is co-creation. Co-creation is one of my favorite parts. It's about listening and sharing. It's about giving people a safe space to tell us about their problems in the hospital. To do this, I organized some fairly long sessions in which as many people as possible participated. The more people participate, the more opinions, and the more enriching the proposals, and at the same time, more people will end up championing the project as their own.
The goal of these sessions is to be open with Albert. Feel free to tell him your ideas and proposals. I would like you to really tell him what you think so that he can help us in the best way. I don't know the method he will use, but to the extent that we can give him as much information as possible, I ask you to do so.
As a result, I had the opportunity to meet with almost 300 workers and more than 100 patients and companions. I was able to sit in front of them, look them in the eye, and listen to all their concerns and visions. And I can assure you that this knowledge is worth its weight in gold.
We thought Albert came to talk, and no, he came to listen and listen. I like that very much. It is a good place to start.
Aside from all the formal work sessions we did, there was one thing I really enjoyed doing. I was able to tour the hospital during the day and at night, and I took the opportunity to talk to both staff and patients outside of the formal working group setting. Because that's where they can be much more honest and sometimes tell you things that in other environments they might keep to themselves. Without prying eyes and in complete trust, it is easier for someone to open their heart to you and share their concerns. When I talk to hospital staff, I don't just focus on the healthcare staff. I talk to each and every area of the organization. From the person manning the entrance gate, the ambulance drivers, the cleaning staff, the kitchen, the administration, the receptionist, pharmacy staff, and obviously the healthcare staff. Because you never know where a key idea for the project will come from, because many of them are in very close contact with patients and caregivers. And the sum of the interaction of all of them is what leads to a comprehensive view of the culture of the organization. As I told you, the aim of the project was to improve the level of humanization of hospital care. And for this, I defined a work methodology based on 4 areas. The first was the improvement of the physical spaces. The second is how we could improve the attention to people with a more empathetic and warmer treatment. The third was how to communicate diagnoses, bad news, and different types of interactions, but with communication that was effective and effective. And finally, the fourth was to rethink both processes and the use of technology.
Health can often depend on the smile we give a patient. For me, it is a combination of medicine and love. They must go hand in hand. Then when you give a word of encouragement and love, you give hope and the patient's attitude changes. They begin to understand that most of the time there is hope, and they cling to that to move forward.
I am loved and I will fight to stay alive. I feel this is important to the patient.
When he is attended with gentleness, empathy, and tranquility, it automatically generates peace for him. A very important part of medicine is to be the way patients are treated.
It is also important to focus on the three important segments of people. The patients, the patient's companions, who are sometimes the forgotten ones. There are many pathologies in which the patient's companion can suffer even more than the patient, and of course the healthcare personnel. If these personnel are not well attended and cared for, they will not be able to perform their vocation in a sustainable manner over time. The beauty of this project is that in these days that we share with them, we have already started this beautiful mission of constant improvement in the health sector, and it is a great opportunity for us. The primary mission is to improve the care of people. We talked about the need to generate spaces of intimacy, to make training plans for the personnel, ways to integrate companions in the hospitalization process and to be more empathetic with them. Also to simplify and improve communication between healthcare personnel and patients, creating relaxation spaces for the staff and many other things. As I said at the beginning of the video, I don't know how this story will end, but what I can tell you is that the humanization project at San Juan de Dios de Santa Ana is a reality that has spread like none of us has. It's spread as none of us had imagined. It is exciting to see how local institutions have become fully involved in joining the project. I was also invited to a television program to explain the progress made at the hospital. I was contacted by the government of the country, who is very interested in the improvement of healthcare, and we were able to talk about possible improvements at the level of the country's public system. We've come a long way to get here, but we still have a long way to go, and we are delighted to see that this time we are not alone. It will never cease to thrill me to see people committed to a common goal, supporting each other for the noble cause of improving people's lives. I'm taking with me a lot of thoughts, ideas, and work to be done to start a detailed, easy-to-implement action plan that will start getting results right away.
In short, all these changes we are talking about are necessary. We have to get down to work. We already know where we are failing and what we need to improve. We need to make these changes as soon as possible. Our patients deserve it.
I'm pleased to see a courageous team that has dared to take a self-critical look at itself in order to improve its service. I see a country eager to grow, to learn together, and to improve people's lives. When I see all this, I can only feel hope, because a better world is possible.